Good morning. Today, we'll be talking about the World Cancer Day, which is coming up on the 4th of February, and whose specific theme this year is uniting our voices and taking action. Thank you, Dr. Elebute-Odunsi. It's a pleasure to have you with us today.
Thank you very much for having me. Very kind of you. It's a pleasure to be here, especially at this time to discuss World Cancer Day.
Yes, you're at the forefront of advocacy for cancer in Nigeria. And today we're talking about the World Cancer Day and talking about the importance of uniting our voices. Can you explain to people why it is important?
Well, it's extremely important. And World Cancer Day, just to give you the background, it's an initiative that's been created by the Union for International Cancer Control, UICC. It's an international organization who have been very closely involved with cancer patients, not just from a medical perspective, but also from a supportive perspective, and also to ensure that throughout the world, governments understand just how important it is to ensure that there is good access to care for patients. Now, with the work that they've been doing, the outcomes, the survival of patients improved significantly over the past 2 decades. But more recently, and particularly after COVID, there's been concern that there's been a drop in the outcome of patients for particularly cancer care. And looking at the data, the statistics, it was clear that part of this problem was because it's been difficult for patients to get access to care. And we all know what happened with COVID. Hospitals no longer able to see patients face to face, which is fine for a lot of conditions, but particularly with very serious conditions like cancer, that really has impacted care. And then, of course, in our part of the world and other parts of the still developing nations, we have a number of reasons why patients are unable to access care easily. First of all, the care is not available everywhere. And even where it's available, not all the care is available. Cancer patients tend to need not just, being seen clinically, but different aspects of care. And we know that we're lacking in trying to provide these types of treatments for patients. So altogether, the message basically from UICC has been that we need to increase and to encourage patients to access care quickly. But in doing so, we have to remove the stigma that's associated with cancer, or tell their relatives or anybody else that they've got problems. And finally, I think the biggest part of this, from my point of view now, is to also inform governments to the types of treatment that are available. And that's why, we're very excited that this gives us the opportunity to have those conversations.
No, that's so important, and thank you for that. Now, the first one, obviously, we're going to be talking a bit more about that, which is the, what people need to look out for, how they should not sort of hesitate to do this. But in the middle of that, can you deal with the stigma issue? Why is there stigma? What kind of stigma is there? How can people overcome this? Why should people stop it? We just need to have to deal with that. So can you talk to us first about how people can recognize cancer early and what steps they can take to seek
Yes,
treatment?
I mean, and that's very important. And there's some very simple things that people need to watch out for. Generally for all cancers, any sort of feeling really unwell that doesn't go away for a few weeks, in particular, unexplained weight loss, where you're not trying to lose weight, but suddenly the weight is dropping off. When I cannot be explained, is definitely ask a doctor. Any lump or mass, that you can feel in your body where you're not supposed to feel it normally. And obviously, in particular, that relates to the breast for women, and obviously we should all be checking our breasts once a month around the time of our period. So finding any lump at all that doesn't disappear within, again, maybe 1-2 weeks, better to just ask the question. Any unexplained bleeding anywhere in your body that you suddenly notice, and in particular, again, for women, bleeding from the vagina when maybe, it's not your period, or in menopausal women, so women who have already reached menopause, suddenly start bleeding again, definitely you need to ask for help. Bleeding from the back passage when you pass, go and open your bowels to pass stool. If you notice any blood there, that's not normal. And that, again, you should go and get yourself checked out. So those are the main things: unexplained weight loss, any lumps anywhere, abnormal bleeding from anywhere. Or also, I find in this environment, sometimes just a wound that seems to have occurred that is not healing after a week, 2-3 weeks. And also, of course, cough. Cough is a big thing. Lung cancer, and just even sometimes it shows that people are just generally unwell and I've got a chest infection that's not going to go away. And then maybe one last thing is swelling of the abdomen. Again, in this environment that, is just has come up and is not going away, because that tends to usually mean you're retaining water. And again, here, it tends to be a sign of advanced cancer. So those are the kind of things to look out for.
And what about stigma? How is this issue of stigma? What kind of stigma do people experience? Why? And how can you stop it? How can we, as a people, stop that stigma?
It's one of the, so the UICC's theme for 2020 and going on for the next 3-4 years really centers on this matter of stigma. And it's the same in all developing worlds. It's not just Nigeria, but of course we see it as a big issue here. And I think it's just the fact that in our environment, we never talk about things that have gone wrong, even in personal life. We've seen issues with abuse and other things, but in medical care in particular, and it's not just cancer. If you look at patients who have sickle cell disease, which is another condition that I look after, again, there's a stigma with people declaring that they've got sickle cell. So I think it's a cultural thing that we've grown up with. But the message here is that it really is impacting on people accessing care. And people also discussing that they have a problem. And a lot of people who have problems like serious issues like cancer, they need support. They need support from their family, from their friends, from their colleague at work. If you're unwell and you can't go in for the day, you don't want them to feel that you're not going in just because you're being lazy or. So, but being able to discuss upfront that this is the problem I have should make the employees more supportive. So it's not something that has been the typical thing in our environment. And I'm very grateful for the opportunity. And I'm also very grateful for the mother of one of our patients who is on the program with us today, because I think it's when the patients themselves start to speak out and to say, look, this is a journey. And we have to remember that cancer is not a communicable disease. Patients haven't actually gotten cancer because they've done something wrong or have practices that are not usual. This is actually something that just happens, and most of the patients themselves astounded when they have this diagnosis themselves. So it definitely is wrong for there to be a stigma. But like I said, I'm grateful to the mother, and also at Marcelle Ruth, we've been very, very lucky because about 6-8 months ago, a group of our patients by themselves have come together to launch a support group which they themselves named Marcelle Ruth Friends. And the morning that I found them as a group all talking and thinking maybe we'd done something wrong, and finding that actually what it was that they developed this support group. And through the support group, it's been incredible because some of them have found that they knew each other or they knew friends or relatives or colleagues, and they come from all over the country. There was one of the men who gave a testimony to say, especially as a man, men don't want to say that they're going through problems like cancer or issues. And so when he came to Marcelle Ruth, he already felt really isolated, had not been able to discuss his diagnosis with anybody at work or his family or his friends. And then met this group of people, because radiotherapy is Monday to Friday. And finding out from the group, and when they set up the group, he found out that he actually knew of or was almost related to about 10 different people who were having treatment at the time. And they become his, support. And so the change that made for him in terms of going through his journey and his treatment has just been phenomenal. Marcelle Ruth Friends now has, I believe, over 100 patients that have joined it. They've got an EXCO of about 12 members, which they've all sorted out by themselves. And like I said, from all over the country. And actually, I think now they have 1 or 2 representatives from patients who've come to access treatment from abroad, who've come back from the UK and the US. So phenomenal things that are going on, Dr. Ajayi, but I think we need to talk about this more.
We do, and I think we need to also encourage people who are, for example, out there thinking about setting these kinds of things up, who are also alone, to find a way to reach out. Can you tell us what happened to your son and how you found out he had cancer, and take it from there?
Okay, thank you very much for the opportunity. My name is Ruth Bolo Etete. I'm from Bayelsa State. First and foremost, my son David Etete is 15 years old now. He was in a boarding school. So he was complaining about being feverish, headache all the time. So we're asked to take him to the hospital from the school sick bay. So we took him to the hospital. Doctors carried out, asked us to go for tests of malaria, typhoid, those usual normal malaria, typhoid tests, and we did, and they diagnosed all the time malaria, typhoid, and all the rest. So we're treating based on the test results. Then he kept complaining about being, dizzy, headache, and all the rest, and being weak. So for about, let me say about 5-6 months, so he was still complaining about it. So we now took him somewhere, and the doctor asked that we should go for a CT scan, seeing it has been a continuous process, that we've been treating malaria and typhoid and still complaining the same thing, that we should go for a CT scan so that we'll know what exactly is wrong with him. So we took him for a CT scan. It was there and then. He discovered that there was a tumor on his brain. So, they advised that we should take him outside the country. You know what is involved.
Of course.
We're thinking of visa and all the rest. First and foremost, since we were advised that we should take him abroad to do a surgery or other treatments, so we were thinking of that. Actually, we applied to several countries waiting for the visa, but it wasn't forthcoming. So the situation was getting critical. So a brain and a spine surgeon, a neurosurgeon in Abuja, I think Dr. Biodu, referred us, that advised that we should take him to Marcelle Ruth. Marcelle Ruth in Lagos is a very good hospital, that he can vouch for it, that we can take him there instead of waiting for visa and other things that is not forthcoming. We're still, holding on to it, and the situation was getting bad, really bad. He couldn't walk. He could not walk. We were virtually aiding him to work. So he advised that we should take him immediately to Marcelle Ruth. That was why we went to Marcelle Ruth in Lagos.
And since you've been there, just you've had successful treatment, yes?
Yes, when we went to Marcelle Ruth, that was August last year, when we went to Marcelle Ruth. I don't know, one thing that I could really talk about Marcelle Ruth, from the gate, when we entered the gate, from the gate, the guardsmen there, they really made things easy for us. They directed us where to go, and when we went inside, they asked us to, fill in, some forms. Already we've told them that we're coming. We've already sent a mail to them that we're coming. So when we got there, things were really easy for us to do. So we saw doctors, the oncologists came and advised us on what to do. So we started the whole procedure. They said we're going to take he's going to take chemotherapy first before radiotherapy. So we started with the chemotherapy, and it went well. Actually, it went well. We're not only talking about the drugs or the treatment, the nurses, the doctors did there, but we're talking about, I also want to talk about the emotional, the emotional well-being of patients they showed there. It's something else. When I went in there, I was really down. I was really, when I discovered, when I was told that my son had this problem, I was really sad. I was confused. I was thinking, how did it come about? Is it as a negligence on my part, or what is it that I didn't take care of him, good care of him very well, or what? I was really bad. So, but when I got in there, the advice, before they start the procedure, before they started the chemotherapy, they gave us counseling on what we should expect, the side effects of it and everything. But after telling us, and when they started the treatment, there was nothing to worry about. With time, my child, was picking up gradually. Before he was okay. He was able to walk without being aided. He was virtually doing the things he wasn't able to do. Fantastic. So I would say kudos to Marcelle, Ruth. God has given them wisdom. God has given them knowledge to put this thing in place in Nigeria. If you ask, so God has given them, like what I said, God has given them wisdom. God has given them knowledge. He has provided, they've been able to provide the right equipment to carry on to treat this cancer-related illnesses. So I thank God for a place like that, an health facility like that, Marcelle Ruth. I appreciate God that He has positioned people with knowledge, with wisdom, to carry on to tackle this problem that will make people to travel abroad, thinking of money, thinking of how to get there, the trauma you go through, the ordeal you go through in getting all these necessary documents to travel abroad. This is now in Nigeria. We are here, and I've seen it. I've gone there, I've been there, my child has been there, and we came out victoriously. So if you ask me what advice I will give to people that are going through such things, I would say there's no point going outside the country. Whatever you're looking for outside the country, abroad, it's here. So I will advise that they should go to Marcelle Ruth in Lagos. They have competent people there. The staff are well behaved. The encouragement, the concern, they are not concerned about only the treatment or the drugs that we administer to you, but they are concerned about your emotional well-being. They are concerned about everything, your totality, the well-being of the relative of the patient. Their encouraging words, their prayers, their concern. I cannot compare it to other facilities. I'm not trying to paint them white or something, but this is what I've experienced. This is what I've seen. This is what I went through. So I'm advising people that are having such, cases. Don't think of traveling abroad. Don't think that it's a death sentence or it's the last bus stop. No, there is hope somewhere. God has given these people the opportunity, the wisdom, the knowledge, has equipped, this hospital with state-of-the-art facilities to tackle this problem. So I'm advising people, don't hide yourself. Come out. Once it's diagnosed, earlier on, we didn't know this was what my child was going through. We were thinking we're treating malaria, typhoid, and all the rest. But when you see that your relative or your person is complaining about a particular kind of illness or something for a long time, go for the next level to diagnose what is really wrong with the person. We were busy treating malaria, typhoid. We didn't know that something else was behind it. So when we got to the knowledge of it, we went in for it to think of a way to handle this situation. Don't just say, I have prayed to God. God is the one giving people knowledge, wisdom to tackle this problem. Don't say, I've prayed and let me relax. I hear of some person saying, I prayed, my pastor laid hand on me and it is gone. Sometimes, fine, we may face whatever that is happening. We may face it, but there are times you go. God has positioned people to be of help to us. So I advise that you shouldn't, any patient, any person that is going through such a case or a cancer-related problem, go to Marcelle Ruth.
Okay.
But I am not trying to promote the facilities, but this is what I'm
fine.
saying.
It's what you have been through, and we appreciate what you're saying. Sincerely, it comes from the heart. We really appreciate you.
Yes.
Thank you so much.
Yes.
Thank you so much for sharing with us. Elebute-Odunsi, that was indeed a rousing testimonial, and we really appreciate the patient for sharing her experience with us. Now, we need to talk about other kinds of patients, because we thank God that this patient was able to afford care and come and afford care. But there is the National Cancer Health Fund, and we'd like to know if patients from Marcelle Ruth can access such funds and access care through that.
Okay, thank you very much. And I also want to say thank you to Mrs. Etete for her testimonial, which I was hearing for the first time, and I'm very pleased that they got such good care with us. Our main vision was to provide all the care that cancer patients need under one roof. So state-of-the-art care, but all under one roof, comprehensive cancer care are now available in Nigeria, which helps to reduce the anxiety and the frustration and the difficulties for the patients and their families if they have to go to several hospitals. And to mention that David had both chemotherapy and radiotherapy at Marcelle Ruth, which is only one of a number of places where you can access both these types of care in one place in Nigeria at the moment. With regards funding, honestly, this is a huge issue and remains a huge issue for the majority of patients because, as you're aware, the private health insurance doesn't cover cancer, not just in Nigeria, most places in the world. It's difficult to have programs that cover cancer. And cancer treatment is expensive because the equipment is very expensive, as is the treatment, the drugs themselves. Now, with regards to the Cancer Health Fund, my understanding, when we came back to set up Marcelle Ruth, we've been operational now for 2 years, was that this was something that was supposed to be for patients to access both from the public sector and the private sector. As I'm sure you're aware, because you're the president of the Healthcare Federation of Nigeria, this has only, after years and years, and kudos to all those who've been pushing for it, only come into place recently, I think in the last 1 year, the Cancer Health Fund. And at the moment, it's still only being implemented in the public sector. And I think only for 1 or 2 conditions at the moment, maybe breast and prostate. I'm not even sure about cervix. So it's still very limited where you can get it, how you can access it, and certainly not available in the private sector. And this is something that needs to change, really needs to change, because the government has to put in place opportunities for patients who do come forward, who brave the stigma and come and access care, not to have their care delayed because of funds. This is very important.
Yes, thank you for saying that. The Healthcare Federation, as you know, was one of the pioneers who pushed for the Cancer Health Fund and continues to push and make that call to say that there must be inclusion of the private sector, that patients should be able to access care in both the public and the private sector and have access to those funds to pay for it. Now, unfortunately, the time is already gone. And so do you have any last words for our listeners? I know you're having a walk coming up. Can you just let people who are interested hearing of this now, let them know how they can join you on that walk to raise awareness and to reduce the stigma about cancer? Thank you.
Yeah. Thank you very much. Yes, this is our second, but it's going to be annual now, Cancer Walk, to close the care gap, which is the theme from the UICC. We had one last year and we had a huge turnout of over 500 people. And this year, we're hoping for more. And we've been very, very grateful to the Lagos State Governor, Mr. Baba Jide Sanwo-Olu, who is going to actually be leading our walk. We feel extremely grateful that actually Lagos State government is supporting and listening to all the advocacy that's been put forward to them. So it's on Friday, February 3rd, Cancer Day is actually Saturday, but there is the marathon. So we very quickly moved it to Friday. So 7 a.m. prompt outside Lagos State House on the marina. We'll be setting off on a 5-kilometer walk, and people can walk at their different paces. And we're going to be walking to Marcelle. Ruth. It's 5 kilometers going past Eco Atlantic. And we hope that everybody will join us.
And where can can anyone get further information about this? So
if we come to our website, www.marcelleruth.com, Marcelle, M-A-R-C-E-L-L-E, Ruth.com, there is a link that allows you to register for the walk and get your t-shirts and caps, and please join us. Thank you.
Thank you for watching. Please like, share and subscribe for new video updates.